start off with Dr. Agnès Delaborde. Dr. Agnès Delaborde is the head of the Artificial Intelligence Evaluation Department at NMI, and she specializes in assessing the impact of new technologies on human users and industry.
Thanks a lot. Good morning, everyone, and thanks a lot for welcoming me here. I'll tell you a few words about myself just for you to understand what is going to be the objective and the topic of my presentation. I come from the computer science field. I joined LNE 7 years ago. This is where I learned metrology. And I would like here today to present, the state of the game in generative AI and artificial intelligence at large from the point of view of computer science and the way we see and tackle the topics of metrology. I think it goes well with the rest of the spirit of the presentations because, we can see it from both sides and we will see where we can converge together. I cannot move my slides. It's good. Yeah, computer scientist, I told you. Without AI, I cannot do anything. Okay. So on the scene of AI, you are certainly aware of what is going on, but just to confirm. So first of all, at the European level, we've got one big thing. It's the AI Act. So the European regulation for AI that has been published, that will be enforced at several different times among the years. But we see also the emergence of many international, it's not international regulations, sorry. It's national regulations in many different countries. Sorry for the wrong shortcut. So we see the emergence of topic of conformity assessment, just to let you know. So we work closely with industry, and so far there was no really regulation. So producers of AI, it's not that they didn't care, but there was no obligation to do anything, in fact, really concretely. So now we are dealing with, the main discussions are on conformity assessment. We're talking as well of certification, and in the context of Europe, it's CE marking for AI. CE marking is well known from many different fields of industry, but for AI, it's fully new, and people, most of the time, they don't exactly know what it is about. We've got big concerns as well about safety, trust, ethics, societal impacts. I think I've got the main words here because of the potential, and I say potential, risks of AI that are at the moment quite hard to determine and define with precision. So we also have the speed of evolution, generative AI, the topic I'm going to tackle today. Generative AI, I don't know to what extent you are familiar with the topic. Anyway, I'm going to show some examples with cats and monkeys, you will see. The idea of generative AI, it's highly advanced systems, and it seems to the community at large that generative AI arrived all of a sudden. All of a sudden, there was a burst in the capabilities of AI system. AI system was good already, but all of a sudden, it became really powerful. So the speed of evolution is a matter that we have to deal with to be able to follow this evolution. And another thing that we have to take into account is the fact that AI is used in many different industrial fields, medicine, so healthcare, aeronautics, whatever field you may name, there is AI in it. So we have to take into account the specific aspects of AI in a various number of domains. So on the whole, what we all need and what we all want is reliable means of estimating to what extent the AI does what we expect it to do. In the previous slide, I used the word performance just to let you know I use performance as a general, really general term. So it means whatever type of success of the AI. It can be, does it do, the task that is expected, but also the economic impact of it, the reliability, the safety, etc. Just for this discussion, if I talk about performance, it can be anything. A quick word, I've put all the words here, difference between the traditional AI that we also call narrow AI and generative AI. Generative AI, there is no trap. The idea is to generate content. The previous versions of AI only predicted things, but they didn't really create new knowledge. Generative AI combines everything that has been learned. So in the training data, it's a combination, and they output a probability of what could be something reasonable. Sorry, it was so vague to tell it this way. I will go perhaps a little bit into more detail, but you see the idea, it's generation. An example, I didn't lie, there are cats in my presentation. You see an idea, and I'm pretty sure that if you had the curiosity, it's really, those tools are easily accessible now. And sometimes and often there are being put on your mobile phones, etc., without you being really aware of it or no. Well, it's another question, but now it's really commonly accessible. You can generate images, you can have discussions. The discussions, this is what is really interesting, and well, we are really cautious with that. The discussions that we may have, the example I gave here is Copilot, but you also have ChatGPT, etc. The problem with these discussions is that it seems that they are really intelligent. The machine seems really intelligent, clever, with a capacity of reasoning. It's a major issue for us because we know it's not intelligent. We've got, here come the monkeys. Another thing about that, about generative AI. So here I give examples of generated images. I give you here what was the prompt. I wanted a picture of a monkey. If you can notice at the bottom right, I asked for the monkey to be seated on the branch. It is seated on the plane. I found it just funny, but it shows that indeed there is no intelligence behind. The system doesn't know what a monkey is, it doesn't know what a plane is, and it doesn't know that a monkey can sit on a plane, but it's not what I wanted. In fact, it was clear from my sentence. So you see the limitation. In this case, it's just funny. My daughter loves this example. But you may imagine that there are some more dangers. So societal, political, and safety dangers. I made the decision, I don't know how to say it, to use press release, etc., media, and to show you some dangers. I'm talking here, it's only media. I won't go into detail, you can read a bit. You see the idea. Chatbots going wild, so impact on companies, impact on political figures as well. It seems to be not exactly what we want, but also in terms of diplomacy, generation of fake image, etc., a big impact on diplomatic relationships. When I said perhaps it's a mistake to have taken press release, it's because there is one thing we are fighting against, is the fact that press most of the time is, I don't know how to put it, they are increasing the fears. And unfortunately, it affects, well, computer scientists, but also political leaders as well. So the importance for generative AI is to really understand what are concretely the risks and what is science fiction. I'm not going to give an answer today. I'm just going to tell you what we do at international level. And at one point, I will also come to the topic of metrology, naturally. I will go really quickly just to tell you from what view I'm going to see the topic. So we've got on one hand, generative AI used for metrology, but metrology of generative AI. So naturally, I will talk of the second one. I think it's quite clear, plus we saw examples from the presentation by the professor. Gen AI can be used for metrology, generating data sets for calibration, etc. I will go quick. It's not the matter here. Now I'm going to talk about metrology of generative AI. So naturally, you take a measuring tape and you just measure AI. It's simple. End of the presentation. No, sorry. End of the joke. So most of the time when we talk about metrology of AI, I'm quite used now when I talk about it with metrology people, even inside LNE. No, people say, no, go away. Okay, no, we're trying. So if I won't go into detail on that, just to give you an idea. If we consider some general strong principles of metrology, where are we concerning AI? And we are honest with that. I won't say we are nowhere, but a lot of work has to be done. So for example, on units of measurement to characterize performance, we don't have really units. I don't know if we need really units, but currently we've got metrics, so way of computing, doing computation to observe a certain level of performance. We've got some agreement internationally. I give here an example from OECD, where they try and list some commonly agreed upon metrics. But still, there is no strong and real references. So it's one thing that we must work on. Still working. Calibration. Oh, I do love calibration. For example, calibrating a test bed. When, if I consider, for example, at LNE, we've got simulation for testing physical devices with AI, naturally, devices were embedding AI. And the simulator is here to depict the real world in which the device has to move and act. The question that people often ask us is, well, to what extent the simulation is okay, in line with reality? How do you estimate it? And the answer is, it's really hard, because the AI is expected to act in a really complex environment. And it's not a matter of only one mathematical model, it's many different mathematical models, plus one thing that we don't know exactly well how to model is the human. So the human behavior, we saw ChatGPT, you have as a human to discuss with it. So it needs to adapt to your preferences, etc., to show some reasoning, human-like reasoning. You see the idea. So calibration is a really, really hard topic. Questions of traceability, it's been tackled just before. The uncertainty, oh, yes, the human error, but not only human factors at large around the systems. Many questions about, well, a bike. If you take a product, a bike, you know that it's expected to run on roads and in the forest, etc. You can characterize in what domain it's expected to behave well. For the AI system, plus the new generation AI system, they are expected to act in many different contexts, and we don't know them all, and we don't even know to what extent the system can produce results. It's a bit vague what I said, but you see the idea. We don't exactly understand what the AI could do. Questions of accuracy and precision. Naturally, we need some reference value. What is a good accuracy level? It depends fully on the context. It depends on many things. I talked already about the advancement and the question of conformity assessments. Naturally, we need a really strict approach. I won't go into the detail of that, just to give you some ideas of what is hard currently. So for example, one thing that makes people talk a lot is bias and ethics. AI could do things wrong for society, wrong for a human being. The problem is the fact that, well, for bias and ethics, it's also based on cultural values. I really just put it like that. I cannot see the link with metrology, and you can imagine what are the indicators of what is biased or what is ethically correct? So as you can see here, in artificial intelligence, we mix really different approaches, different fields, sociology, psychology, ethics, that is a real science as well. We have to combine them all, plus statistics, naturally, plus mathematics. You see the idea. And we have to have all these people talk together. And for metrology and defining good indicators, we need to have all these people converge on what can be really accessible, measurable, observable, etc. I move on. So you understand the idea of what metrology will, in my opinion, it will bring for generative AI. It will bring some reliability, transparency, well, trust, only trust. It can cover it all. Many research questions. I didn't even cover half of them in my slides. Many things that we need to address. But naturally, we need it just now. As I told you, there are regulations behind. One thing I would like to point out, just for your information, now that I'm with LNE, so I told you 7 years ago, I'm pretty cautious about the way people outside use the word metrology. Artificial intelligence community is really good at taking other fields of science and declaring all of a sudden that there are experts in that. The best example I have is ethics. Ethics is a real science. I mean, with experts that go to school of ethics. And all of a sudden, we all became experts in ethics. Currently, and I'm pretty glad of that, metrology is the new buzzword in my community. So yes, we've been at LNE fighting a lot to direct all the efforts towards metrology of AI. But okay, people are convinced now, but unfortunately, they are using the word metrology. And to be honest, I'm not pretty sure that I've even ever talked to one metrology expert in their lives. So we have started a new fight just to tell them, no, stop with metrology. Please, sorry, just wait a bit. Let's create links with metrology experts. So, well, it's this way, well, life goes this way, so, well, at least it's good. It's good they recognize at international level that metrology is the key. So I just named here some many initiatives worldwide, well, international initiatives currently. I won't go so much into detail there, just to let you know that I guess almost all of them said metrology at least once in a discussion. So we stick to these communities just to ensure that at the good moment where we'll be able to establish the good link. One small action, well, of advertisement for those of you who are interested. There is in France an event, international event. It's not any type of event because it's the president of the French Republic that announces it, the AI Action Summit. That is going to gather, well, science, but also political leaders around the world about the topic of safety, control, and trust in AI. So in February. Well, this is good for me, and thank you.
Thank you. Our next speaker is Professor Dr. Tobias Schäffter. And Dr. Schäffter is the head of the Division 8, Medical Physics and Metrological Information Technology at PTB in Berlin. He is responsible for the development of new quantitative measurement techniques in medicine, as well as data analysis and information technology. So.
Yeah, thank you very much for the kind introduction. And it is always a danger to be the third in a row. But there will be some repetition, but sometimes repetition is also good. And it also gives me the opportunity to go a little bit more into detail. I guess I don't have to tell that much more about attention about artificial intelligence in society, in business, in science. And we have already heard this morning that the Nobel Prize in physics, but also half of the Nobel Prize in chemistry is going to artificial intelligence. And this is quite interesting because when we're talking to physicists, there is a little bit, discussions going on. So how much physics is actually in the Nobel Prize of Physics. But for sure, in the Nobel Prize of Chemistry for Hassabis and Jumper, they have really used the AlphaFold to predict the protein folding. And this has a tremendous impact on chemistry. And this is really also a game changer in the way the chemistry will be made in the future. When I've seen the announcement of Nobel Prize in Chemistry, I think that was last Thursday, then there have been some traffic on the social media. And there was an artist, and she was very much afraid that the Nobel Prize in Literature in 24 would go to ChatGPT. Fortunately, this hasn't happened. But it means also that this ChatGPT, and we have seen the previous talk on that one, is very much an acronym for artificial intelligence in society. And this is also that if you're looking on the way the users take over or how many users are using these kind of new technology, this is a tremendous change. So thinking about Netflix in '99, that was something like it took a few years to get to the 1 million users. Facebook, 10 months, but ChatGPT in 5 days. So it's all in society, it's in daily business, and a lot of people are using that. And that's why it is such a important thing, and also to look really in detail. And I'm very glad that the previous speaker has has shown some more things on the generative bit. Maybe one remark also there, this transformer technology, the famous paper in 14 came out of Google, and also the Nobel Prize in Chemistry. These two people are with DeepMind, a Google branch at the moment. So it's something, a lot of things happening, unfortunately more in science now in these large companies, and this is also a change, I think, within this direction. So ChatGPT, big publications showing extra productivity in writing. A lot of people are using this also now for coding, and the codes are quite good coming from ChatGPT. This is also something where sometimes also quality of coding could be enhanced by using generative AI. Still, you have to check. Still, you need other tools to check it. And it's good always to understand, of course, but it is also sometimes a good way to obey certain coding standards, which ChatGPT can do quite well. There's also some downside, of course, and things have been mentioned already. And one term which is out is something like called dementia. And it means that ChatGPT behavior is changing over time. And this is a quite interesting paper by two groups from Stanford and Berkeley. And maybe as a side remark, this paper is just out on as a preprint on arXiv, published something like a year ago. And it has already 400 citations. And that means that this kind of technology is so fast that this peer review process is not can cope with that anymore. And a lot of things happening, and also the speed which is happening is so fast that science is really changing in this field very, very much, I have to say. And interestingly, so they have asked ChatGPT a number of questions there, and also some math questions, for instance. And then they see that the questions or the behavior of ChatGPT is changing, and it depends on the different versions. And it's also interesting, if you look to this paper, the way they measure accuracy there, and also why accuracy at all, if there's a certain detailed math question, should be not 100%. And reasoning is, it depends on the prompts which you're doing. There's a complete field like prompt engineering, and there's a way how you're doing the prompts. It's called chain of thoughts. type of prompting, and this could result in different ways of answering than you would do other prompts. So this is, I think, quite dangerous because it depends how you're asking, what kind of answers you're getting. But what we need, and this was also mentioned in the previous talk, we need benchmarking for that because we want to see if the tools which we're using are reliable. And then the other bit, probably all of you have heard, the hallucination, again, not only in the news, but also in a lot of big articles in Nature and other fields. And if you're looking there, then the reason for that is, for this misleading information is due to overfitting, quite well known in data science, high model complexity. Yes, there is these neural networks have a high number of parameters, but more important, about training data quality. And this is one of the main things, again, have been mentioned in previous talks already, but I think this would be one of my message here in this talk. As metrologists, we know about measurements, we define the precision and the accuracy of measurements, and these kind of measurement results is the quality of data. And already also mentioned EU/AI Act. I think a long law which you to read. There are three main foci I like to say here is something like that the trust in algorithms that are not fully understood, but it needs to be for high risk applications. So meaning that we should focus really on the high risk applications in certain fields, and I come to that in a second. Mainly, AI strongly depends on high quality training data, as I said, and then there is the question of AI quality, and certification of AI quality requires robustness, accuracy, security, explainability. So if you look into the AI Act, Article 10, it's all about data quality, about data management and governance. So it's quite essential. Really, this is the base. If you look into Article 15, I think this has been mentioned before, and this is about accuracy, robustness, and security of the AI. And there it is recommended cooperation with relevant stakeholders, organizations such as metrology and benchmarking authorities. So metrology is clear, benchmarking authorities is not yet defined. And there they need development of benchmarks and, very important, measurement methodologies. Accuracy metrics and high-risk AI systems should be resilient against errors, faults, and inconsistencies. Again, if we're talking about errors, faults, and inconsistencies, we're talking also about data. So, since this AI Act is now in force, and people from August now on, and latest in next year, they have to obey this law. The law is quite generic, and there is so therefore a little bit of a vacuum how to deal with this AI Act. And for that reason, the EU Commission has also funded so-called regulatory gray zones, sandboxes, testing and experimentation facilities. And these are large-scale reference sites open to all technology providers across Europe. And the idea is to support especially industry, but also AI developers to bring trustworthy, secure AI to the European market. Lot of funding there is co-funding between European Commission and the member states, roughly 50 million for each of these themes. And they have funded 4 themes. One is in agriculture, one in healthcare, one in manufacturing, and one in smart cities. And the PTB is active in the health one and in the AI matters. And from now on, I will talk more about health as one example. There are also similarities, but there are also differences with all the different fields. But let me use the health as one example. And why is health a good example? Is because it is risky in itself, because it's, our health is depending on certain decisions. But it is also super taken up by the industry. And if you're looking to FDA-approved medical products which contain AI, then until 23, already roughly 700 has been already approved by the FDA. And just from this year on, an additional 170 have been already approved. So it's a huge increase and a huge way where products come into market, and we have to deal with that. Interestingly, mainly in radiology and cardiology, but other fields are also starting to raise. So let me briefly mention the testing experimenters facility health, a huge project, 55 partners, funding 50 million over 5 years. And this is coordinated by the Charité in Germany, in Berlin. And there is, we are involved in the work package 6 standards and quality. We're very closely working also with other partners like Fraunhofer and also academia. And we're very much also working together with the work package 7, which is about certification. And there is the notified body, the TÜV, and they trying to get something changing there that we're thinking about in this project, about a way that we do agile certification in order to speed up the process, how to bring products much faster onto the market than today. And very important to mention, in work package 4, this is led by LNE working on the virtual test center. So again, with the colleagues we have just listened, we are working very closely. All right. So let me give you 2 main bits now to go a little bit more in detail. The data is the base of AI, and we should think about quality very much of the data, because the quality of AI depends on the quality of the data. Data uncertainty, and what I like to mention here already, annotation inconsistencies. And here is where the human factor is coming into play. The data scientists call this usually the label noise, and I come to that in a minute. I think it's clear, it has been also mentioned by Cornelia Dentz, that we need some standards for data quality. I don't want to bring Cole to Newcastle, don't explain this to metrologists here, but we need, of course, precision and accuracy of the data and the measurement. And what is really essential is the term representativeness, and it means that we want to make accurate conclusions about the population from a sample. That means if you have a diverse population, of course, you need the same representation in the training data set. And it sounds very easy, but in practice, it's not easy to obey, and it's also not easy to check. And so this is a quite important bit to think about that. Let's briefly touch why we believe precision and accuracy is our daily business. This is some work we're doing in Germany, where we have a data quality system for lab medicine. And the idea is that we have a central organization that's called Instant, and they are sending a sample to different reference lab and also to PTB, and with 2 concentrations. And then you would get that kind of so-called Udon plot. And if everything would be fine, everything would be ending in 1 point. And each point here represents 1 lab, and you're seeing that most of the labs are really inside the box, and some of those are a little bit outside the boxes here. And then they have to look what's the reasons. Could be pre-analytic, but could be also something wrong with the methodology. And this is a quite good example, cholesterol, and because you can see there are 2 clusters here, because they're using 2 different types of methodologies. And this is quite dangerous, because if you would now pool data from different sites, you would assume that there would be not much difference. Maybe there would be some kind of noise there, but there should be no clustering. And we see now clustering about methodology, and that could overlay the clustering which we want to measure, the clustering due to pathologies. And so I think one take-home message from this that bit is already, if you have these clusters, you have to put this part of your data. You need to know which kind of methodologies you have used, because if you're pooling later, you want to know where this is coming from, and you want to make statistical, use statistics for taking that into consideration. If what you also can see is that there are a little bit more sites here on that cluster than on the other one. And the question is how representativeness is there, and how representative this is really for the large field of the data points. Again, something which we should consider for our training data later. As Cornelia Denson mentioned, we have looked a little bit into the literature there. We made a Prisma review in that way, where we looked in 5,000 articles about data quality and the impact on artificial intelligence in medicine. And there we see that all these articles you can cluster in 15 different dimensions, and you can cluster this also then in 5 different clusters, like the measurement process, timeliness, representativeness, informativeness, and consistency. And what is very nice, this results to the term metric, which we believe is a quite nice thing, and it's also a framework. Important to say, we very much active so far in the measurement process. This is something that metrologists do the whole day. There's a little bit what is called the human induced error. I come to that in a minute. And there is a lot about statistics about this representativeness. And the interesting with these 2 clusters is these are mostly quantitative. And so the next step in this project, what we're doing in this health is that we want to provide tools that we can measure really the kind of errors and also the quality. And the vision is that we can give a little bit of quality score to data sets, and also people can use tools then to check their own data set, and this is maybe a good input for the notified bodies that these things have been at least checked to a certain extent. All right. If a data set is very good, we would make him maybe not silver, but even gold. And even better would be a reference data set. We started with that a few years ago, where we worked in the area of electrocardiograms, ECGs. You probably would agree that there's a lot of ECGs, and it's very difficult for a physician to look on all these different long duration ECGs, and therefore artificial intelligence is quite nice, a good tool to do the analysis on that one. And so what we have provided then is a reference data set. This is something like 20,000 patients, but also healthy volunteers are also included. We looked in different pathologies and taking representativeness into account. Reads easy was quite some work, I have to say. And then what is more important, we defined really the training, the validation, and the test data folds, so that everybody who is using this data set should use the same training data and the same validation, that we can compare results afterwards. And this has been published in Scientific Data. This is a Nature journal, and this is just open data. Everybody can use it. And this is heavily used since 4 years, 70,000 downloads, more than 700 citations. And we have extended this one now with PDB-XL Plus, added also some features to this bit. Again, open data set, everybody can use that. What is the problem with the data set is that the pathologies have been labeled by physicians. And sometimes you can see that there are inconsistencies between different physicians. Some people say, yes, this is a certain disease. Some people say, no, this looks to me quite healthy. And these are the interesting cases. We left them in because this is really the bit where we have to have in for the training. But it means we need also something where we get a little bit the human factor out of the place. And there I can recommend this nice book of Daniel Kahneman, the recent one. And there's a statement, wherever there is human judgment, there is noise, and there's much more noise than you can realize. And in this book, he really touched medicine as one example, also law, but the medicine was one nice chapter. And he said, we need some kind of noise audits. See, we need some way to reduce this noise between different bits. This is something which in medicine is known for quite some time. They call it inter-observer variability. And this is also has been also observed in the literature, how this impacts then the machine learning. And this is one of the strongest noise what we really having, and the strongest impact for the data quality and the AI quality, I have to say. And one way to circumvent it is to use synthetic data. And this is a work we have done in the European Partnership Program, where we have simulated the electrical activity in the heart by biophysical modeling. And then if we have this in silico modeled this bit, then we can project this to the surface, to the chest surface, and then we can get on any arbitrary points the ECG. In that case, we have 256 possible locations there. And then we cannot do it once, but we can change the heart, we can change the orientation, the size, and we can put pathologies in. So we create a virtual population of synthetic ECG data. And this is very nice because we have a digital traceability from an echocardiogram to one specific set of parameters, digital parameters, which has driven, so to say, the biophysical model. Again, we have published that one. This is used, and this is something like a ground truth, which people can really look how certain things will change. We can change things on purpose. We can mislabel things from healthy to unhealthy and can see how this is propagating. So it's a quite nice toolbox which we can use there. I'd like to give you a little bit things on the AI quality. And here again, I like to talk briefly about robustness, accuracy, and very briefly about explainability. And would like to give you one example. This is machine learning for image reconstruction. This is something where what the vendors at the moment doing quite strongly. Industry is moving very much in this direction. If you're using deep learning for reconstruction, that means the raw data resulting in some kind of the real images here the heart, which is beating. This needs complex convolutional neural networks, high number of parameters, and therefore high amount of training data. And what I like to tell you as an idea is that we want to put a little bit trust into that bit by putting physics, by putting metrology, the measurement process, as part of the learning process. We call it physics-informed learning, as other people do. And this is one bit. And then also we not only calculating or reconstructing the mean value, but also the deviation. And there we can get some kind of uncertainty in that way. So I like to show you that the physics-informed learning results in higher robustness, and also give you one example on the uncertainty. So this is a data set which would take usually 10 seconds. If you would accelerate just using only 1/8 of the data, then we get these kind of images with a lot of artifacts and that kind of error, what you're doing there. And then we can get, we can use deep learning for reconstruction. And two examples here, we look nearly the same. One is with normal neural networks, one with physics-informed. The main difference is normal neural network, 300,000 parameters, physics-informed, 3,000. And therefore, it's more robust. It needs less training data, and it gets a physics guide rail in order to, that is doing the reconstruction in that way. And this is, I find very interesting because this is now a merge of computer science and measurement knowledge and physics knowledge, which have to be combined in that way. A PhD student, Shirin Brahma, he did also calculated also uncertainties here. So the heart here, here's the mean, and what you can see, two different uncertainties. One is called the epistemic, one is called the aleatoric. And the epistemic describes how error-prone is your model you're using, your neural network. And you see some high uncertainty. This is unfortunately an area which is quite important. The area is the right coronary artery. And if there's some fault in that one, that would result in a wrong diagnosis. And if you, again, using physics-informed, the uncertainty goes down. And again, we get the coronary back. So again, physics helps. And physics helps also, I think, in the way of getting more trustfulness into the bit here. Briefly, I'd like to mention quantitative imaging, very fastly go over that. A nice book, which I'd like to make advertising. We have the second edition coming out next year. And there is a wonderful chapter by Andreas Kofler and Felix Zimmermann on machine learning, on reconstruction. Very good textbook, which is then giving all the ingredients and how to do that. And this is the work by Felix Zimmermann, and he did end-to-end physics-informed neural network for quantitative imaging. Quantitative imaging wants to do really biophysical parameters, like in that case here, T1 relaxation times. And this is a very complex process because the equations become nonlinear, and the main idea of his work was how can get this nonlinearity, how can they cope with that, and he has to subdivide it in two problems. But he showed that with this physics-informed neural network, he got much better results than the currently other bits. And again, one thing I like to mention, benchmarking is quite important. If you going for something, then you need benchmarks with existing techniques and just showing that you are have better quality in that bit. I like to skip this one because of mention of time, and I like to say about the benchmarks a bit more. I think this is a quite important bit. I think it's also something for metrology. I think Agnès has mentioned that one for generative AI. I totally agree that we have to do these kind of challenges, comparison studies in a much better controlled way. And again, the societies or the scientific societies are very active in that bit. There's a lot of work at the moment how to make the matrix very nicely in different fields. This is very much use case dependent and is not as easy, but is something where I think metrology should look much more closer into that bit. Some work we have done on ECG using the PTBXL as a reference data set, which is given. And there we realized it is not a single metric which we use. We need a combined way. And from the combined way, we need some kind of a combined scoring from that bit. We looked briefly also on about explainability, means which parts of the ECG would result in certain diagnosis in a way. And this is also really work which is done by Stefan Haufe. He is a joint professor between PTB and the TU Berlin, and this is his main driver is really how to get explainability into the play. And he has done a so-called digital explainability test platform in a challenge style to make benchmarks of different explainable AI methods. Again, we need reference data sets with ground truth for that. And the big thing is how to define performance. What means explainability? It was a question about what is trust? What is explainability? So this is really something which we need much more, but something which is a quite early field, I have to say. And then some work maybe from Mike Liebel, and what he has used is quite nice. Is a test platform which we have used for software testing. It's called the TratSim test platform, and he has extended that one to check for different algorithms for automatic image segmentation, and we get then a test report, and we hope this is really supporting then new developments and also industry, that you can say, yes, I have not only done by myself, but I have an objective, independent way to doing these kind of check and these kind of test platforms. So again, something I think we should look much more into the future, that we supporting industry in this direction. So to summarize, data is the base of AI. Data is also the result of metrology. So measurements result in data. this is something I believe which we can do very, very nicely. If you're talking about machine learning, there are more dimensions. It is not only precision accuracy, but there are more dimensions we have to deal with. And we give the first instance there with this metric framework with 15 dimensions. And we at the moment thinking how, or working on that, how to make it in proper tools boxes. AI quality results between other things, among others, on robustness, uncertainty, explainability. And I've shown you one example where we're seeing that physics-informed learning can improve robustness and reduce uncertainty. I think this is one way to put trust into machine learning, putting physics in because physics is something like which is agreed, is a proper science. And if we're getting this into these neural networks, that helps it. And finally, benchmark tests is really the big thing we need all together work on. For that one, we need reference data sets. Again, something I think that the NMI should really hard to work on, either synthetic and real, and also saying, yes, we have checked this, we give them a certain quality and make it as open as possible, make it fair, and then it will be used. And then, of course, metrics. But this is a big thing because this is very use case specific. In medicine, a lot of different things. In other fields, totally different metrics which we need to have to define. So again, interaction between different stakeholders, as mentioned by Agnès in the previous talk. Thank you very much.